Hello, everyone. My name is Mitisha Gupta, and I am your host for today's podcast, Win Over Hypertension, where you can learn how to take care of your blood pressure through exclusive insights and practical advice. Today, we're talking all things about hypertension. Why is it caused, how it matters, and most importantly, how to take care of it effectively. Hello, doctor. It's my honor to have you on this podcast today.
Pleasant morning to all. Myself, Dr. P.V. Balamurugan, MD General Medicine, presently Professor of Medicine at Madurai Medical College and a consultant physician at Ishwara Hospital, Tallagulam, Madurai.
So, doctor, by now we all know what hypertension is. But can you please elaborate on it? I mean, why is it so important for us to take care of ourselves even when we feel fine?
Hypertension is considered as one of the most common cardiovascular disease which causes increased mortality worldwide. But fortunately, we have a very simple apparatus called BP apparatus, which if available at home, you can diagnose hypertension early. And if you start treatment or change the lifestyle early, that can bring a great reduction in BP and also increase the lifespan of a particular patient. So hypertension is an important disease which we should remember, be aware of and control.
Okay, but why is it so often called the silent killer? What makes it so dangerous over time?
So we call hypertension a silent killer because many patients don't know they have hypertension, and since they don't know they have hypertension, they don't check their BP. And because they don't check their BP, the BP slowly starts affecting the organs, and nearly 25 to 30% of many of the cardiovascular disease are attributable to hypertension. So since the symptoms there are no symptoms for hypertension, and it's so silent, it's called a silent killer. That's why we need to check even if there are no symptoms.
So, doctor, I would like to know what are the most common reasons people develop high blood pressure?
They say that Indians consume more salt than many of the countries. Nearly 15 to 20% more salt we are consuming, especially in South. Salt consumption is still more higher. So the salt normal intake is around 5 grams. So we say this much is 1 gram. So whenever you consume more than that amount, that causes high BP. So one of the important factor to increase BP is salt. So you are supposed to take less than 5 grams salt. So many times we take 7 grams or 10 grams, especially pickles, which are common in Indian diet, raises the BP very much because of the increased salt. So you take 3 to 5 grams salt. If you have 5 people at home, you don't need more than 25 grams of salt. So you take more salt. So you need 2,300 to 3,000 milligrams of sodium chloride daily. That you should restrict adding salt to any food which is already being cooked. Sometimes we need not add salt to the rice. These are something you can take. Bringing down salt itself can bring down the systolic BP to 5 to 7 millimeter.
How is blood pressure exactly diagnosed? When looking at the blood pressure readings, can you elaborate on the exact numbers people should be looking at?
The diagnosis of hypertension is so simple. You need just a BP apparatus to check. It is so cost-effective method to check an important disease. It is called a BP apparatus. It is available very easily, and this BP, only 2 values you need to remember, that is systole, another is diastole. The top is called systolic BP, which is around 120, and the lower one or diastolic BP is 80. If you have a BP around this, it is normal. When it increases above 130 bar 80 millimeter of mercury, it suggests you are developing hypertension. So these are the 2 numbers you should remember.
So I would also like to know, if someone has just been diagnosed with high blood pressure, what are the changes you would want them to make in their daily routine?
So once hypertension is diagnosed to any person, The doctor tells whether the hypertension is mild, moderate, or very severe. If it is mild, usually the doctor doesn't give any drugs. He just gives some lifestyle changes like restricting salt, being more physically active, taking more fruits like this. This is enough for mild hypertension. For moderate and severe hypertension, usually along with lifestyle changes, doctor also prescribes some drugs. So it is both lifestyle changes as well as drugs needed for most of the patients.
Can we say that hypertension can be treated without medication?
Yes, as I said previously, in mild form of hypertension, when BP is just above normal, which we say stage 1 or mild hypertension, BP drugs may not be needed, just reduction in weight or changing the lifestyle from adverse lifestyle to healthy lifestyle, restricting the salt, increasing fruits and being more active itself, many patients can bring down the BP. Usually hypertension is a lifelong disease and most of the patient will need drugs for life, but especially those who have very mild hypertension and who are amenable to changes, who change their habit from adverse to healthy habits, can become normotensives or BP can become normal. There are very few percentage of people, still they can, but if they again take adverse habits into their life, they again become hypertensive. So a small percentage of people, yes, can become normotensives with the change in habits.
Okay, I have a question related to that only. Let's assume that somebody's blood pressure is coming under control. Can they come off medication or is it a lifetime commitment?
Exercise is second to food in bringing down BP. Especially aerobic exercise, at least 30 to 50 minutes per day, and most of the days or on all days or week is very important. Especially aerobic exercise with some 10 to 15 minutes of resistant exercises are very much useful, and they should be done on daily basis. You need not restrict to 150 minutes per week. You can have more than 30 minutes per day on all days on a fixed time, and if not possible in the morning, you can do in the evening, any time during the day. This physical activity is going to bring down BP up to 7 to 8 millimeter in a person who is doing regular physical exercise.
Okay, when you say reassess regularly, how often people should check their blood pressure and what's the best way to do it right?
So you can take two types, one who have normal BP, another who have been diagnosed with hypertension. Whenever patients are diagnosed with hypertension, they should check the BP daily basis with their own BP apparatus. It's called home BP measurement on daily, and once after 3 weeks or 4 weeks, once BP is stable, they can check twice or thrice in a week. But in a normotensive people, you can check twice or thrice in a week, and you can just have a BP chart with which you can give the doctor. So for a hypertensive, it's twice or thrice in a week. You can check it once BP becomes stable.
I would also like to know what would happen if high blood pressure gets untreated for years.
So this is a very important question because many people, they don't know they have hypertension. Many people, the disease progression affects many organs. So many times people come with severe failure of many important organs as the first presentation. So they don't know they have hypertension. That's why anyone after 20 years, they should check their BP. So what are the organs which commonly affect? The brain is the most important organ which is affected, where people can present with stroke. Then followed by the heart, eyes, kidneys and many of the big vessels are all the common organs affected by hypertension.
Especially the body parts which gets affected the most.
This is an important thing which you should all remember. Hypertension is nothing but the increase in BP in the blood vessels. So the heart should pump against that pressure. So what happens in the inner lining of the blood vessel wall, there is a breach or a disease or a problem occurs in the inner lining, where because of that breach there an atherosclerosis or atheroma occurs. That atherosclerosis causes the vessel to become more thicker, and when the atherosclerosis occurs in the heart or brain, it can cause heart attack or stroke.
So this marks the end of our podcast, Win Over Hypertension. I would like to say a huge thank you to the doctor for sharing such valuable insights to us. Remember, hypertension isn't just a number, it's a signal. And with right knowledge and action, it's absolutely preventable. If you found this episode helpful, do not forget to like, share, and subscribe, and share your valuable insights with us. Always remember, stay informed, stay proactive, and most importantly, stay healthy. This is Mitisha Gupta signing off from this podcast, Win Over Hypertension.